So being in substance use disorder treatment during pregnancy is such a huge step, and gosh, you should be really proud of yourself for working towards your recovery goals now during pregnancy. And we've noticed that women who make the decision to stick with their substance use disorder treatment program after the baby's born do really, really well. And it's been such a great experience for us to work with women and work with families to help support them in their recovery goals and continuing their progress and all those amazing recovery goals that they have during pregnancy and including after pregnancy. One of those things that you have in your treatment program might include medication for opioid use disorder, like Suboxone or methadone, or buprenorphine is also called. And those medications can help a lot of women reach their recovery goals, help them feel normal so they can go do all the things that they want to do in their recovery. And a lot of women make the decisions during pregnancy, are they going to continue their medication or after pregnancy or not? And I know you might be going through those types of decisions too.
I think one of the things that moms often do who are diagnosed with a substance use disorder is they might make that decision during pregnancy to either continue prescribed medications or to start on medications for their substance use disorder. And then after giving birth, and now in this first year postpartum, it could be a good friend or a family member, or even you might be thinking, well, I took that during pregnancy for my pregnancy and now I've delivered, and so I guess it's time to stop my medication. And what they have found, the medical experts in this area, is that in that first year after delivery, postpartum, there's so many things that mom is going through. First, she has the physical healing after pregnancy and giving birth, and then she's also trying to produce milk and breastfeed and all of those things, and probably with a little bit of different sleep patterns with a newborn at home. And so they highly recommend that you don't stop the medication therapy that you've been taking in pregnancy, but instead continue that medication during at least that first year postpartum. And then at that point, you can talk to your provider and see where you're at. You might be thinking, well, I'm just not really in recovery then. I'm just exchanging one drug for another. And sometimes we hear that, right? Even from, it could be like a super good friend of yours that's saying, well, you're not really in recovery. You're just substituting. And that's actually not true, because the substance or the substances that you might have been using are very harmful. They're harmful to your brain, they're harmful to your body, they're harmful to your relationships actually as well. And so the medication that's being prescribed to you is there to support your recovery goals, and so that your brain can heal, so that your body can heal, so that your relationships can heal. So it's actually very different. And again, as we've already heard, taking medication is just one part of recovery for some women.
Yeah.
So you are in recovery.
We're talking a lot about what we've seen works for women and what we've seen work for families and what we know from research. But you know yourself better than anyone else. It's your body, it's your baby, it's your family, it's ultimately your decision what you want to do with your pregnancy and with your recovery and with your substance use disorder treatment after the baby's born. So we're just hoping that we can provide some more information to help you make those informed decisions for you and your recovery for after your baby's born, and thinking about the option of continuing your medication for your substance use disorder through at least that baby's first birthday.
And one last thing, during pregnancy, we know there's a lot of emphasis on the birth of the baby. And so trying to think a little bit forward to what happens once I deliver and I'm in that postpartum time, what happens at home? What are the things that are going to change because now I've got that baby at home and I still need to make my own appointments? That could include individual counseling, group therapy, seeing your doctor, keeping up with your medications. So thinking about, will you be bringing the baby with you, which you might want to do, thinking about the transportation that would be needed and whether or not the baby needs a car seat for that, and how does that work with your transportation. If you have other children as well, perhaps you might be considering who can help with childcare so that you can make your appointments. And then also the baby's going to also have appointments that you'll be wanting to to have on your schedule as well. So lots of things to do after you bring that baby home, and sometimes we forget to think, about that plan for afterwards.
And I would just say, if you need help with any of those things, making it to appointments, getting childcare, wondering, can I take my baby to group with me? Or can I bring my baby to my doctor's appointments for my recovery? Or how do I schedule my baby doctor appointments and my own appointments for my recovery and they don't overlap? Please ask us. Ask your doctors, ask your nurses, ask your social workers if you need help. Ask those family members and friends too, because we really do want to help. But sometimes we just don't know what you need. So do reach out, because we are all on the one team together, and we want to continue working with you and helping you reach all your recovery goals during pregnancy and after the baby's born too.